My name is Dr. Lesley Iwanejko and I'm a lecturer in genetics based in the Institute of Ageing and Chronic Disease. I have severe asthma and I have something called bronchiectasis, which means that my bronchi have dilated, they're damaged and they fill up with mucus, and it means that I have a very high frequency of chest infections, and combined they've affected my mental health as well, so I suffer from severe depression and anxiety. It means that I'm very tired most of the time. Some days I'm fine. People don't really recognise that I have a disability. I'm very tired in the mornings and I have to do breathing exercises, a bit like the ones that people who have cystic fibrosis do. I have to get the mucus out of my lungs to reduce the chance of me getting an infection and also to help me breathe. So that means that getting in early is not easy. It also means that I get very tired during the day, and sometimes I have to do those exercises during the day. Sometimes I lose my voice, which is very difficult if you've got a lecture to do. It means that I can't walk very far. Even just doing a very minor task is extremely tiring. So even just driving into work sometimes is exhausting. I also have a lot of allergies which set my asthma off. If I'm next to someone who smokes, or in a lecture theatre that's got a chalk board or is particularly dusty, then that affects my asthma. Very prone to chest infection. Sometimes I just have to work at home and sometimes I just can't work at all. There are a couple of things. So the first is that I have a formal arrangement with my manager that I can work at home if I need to, and if it's feasible, obviously. If I've got a lecture or have meetings, then I can't. But we have a lot of meetings that we can do via Skype as well, which is very useful. The other is that we try to arrange meetings between 10 and 4, which means that I can come in that little bit later. That then presents a problem of parking, but I went through human resources and I now have a letter which allows me to park in disabled spaces, which is excellent. I think I would have had to give up work if I couldn't do that, because if I had to park a long way from where I work, on some days that would be fine, but on other days that would be really difficult. When we moved into the new building, it was very clear we were all going to have to share offices, and I did explain to the institute manager that I had to do exercises and that I'm very prone to infections, and although I'm sharing an office with somebody who has desks elsewhere in the university and is hardly ever here, so essentially I've got my own office.